the VA Epilepsy Centers of Excellence, they're a national consortium, so it's across the United States. And they basically, their goal is to provide high quality epilepsy care and to provide a lot of educational resources to patients and their caregivers, so veterans and their caregivers, and then other clinicians. Primary care, they're oftentimes on the front line, and they're the first clinician that patients go to when they have a seizure. And it's very important for primary care to know how to work up a seizure, which medications to start. There are a lot of patients now who are started on really old seizure medications that have a lot of side effects in their newer medications. So the VA Epilepsy Centers really want to have more educational opportunities for primary care to learn about the standards of care for epilepsy. Currently in our epilepsy monitoring unit, which is an inpatient unit, we bring patients in to diagnose their seizures. About 15 to 20% of them actually have psychogenic non-epileptic seizures. And these are seizure-like events that actually have no EEG correlate, meaning their brain waves are normal during their event. And they're caused by a history of post-traumatic stress disorder, a history of abuse, a history of depression and anxiety. And it's not the patient malingering, they're not doing it on a conscious level, but their body is unable to deal with these past stressors and becomes overwhelmed, and it presents as something that looks like a seizure, but it's not epilepsy. And these patients don't need treatment with epilepsy medications. What they need is to be connected to a psychiatrist for cognitive behavioral therapy. Well, I think a huge unanswered question is, in about 60% of patients with epilepsy, we still don't know the cause. You know, in some patients we know it's the stroke they had, or the traumatic brain injury, or it's a genetic malformation, malformation of the brain caused by genetics. But in 60%, we still don't know why this patient has epilepsy. So I think there's more research into the genes that cause epilepsy, or even like biomarkers of, certain biomarkers that may point to a seizure medication that may be better for one patient over the other.